Hey everyone, it's Tim from Lanessa Farms Specialty and Heirloom Livestock. Thanks for joining us again today. As always, you can contact us on our website at www.lanessafarms.com. Send us an email at customerservice@lanessafarms.com or give us a call or send us a text at the number listed below. Today we're continuing our livestock health series talking about how to treat inverted eyelids in lambs and goats. We appreciate your feedback. As you know, all of these videos are made specifically for you based off of the feedback we receive from our viewers. Don't forget to subscribe, and we really appreciate those thumbs up. Without further delay, let's get started talking about treating inverted eyelids. Before we get to the section of the video where I actually go live and show you how I treat the inverted eyelid, I wanted to give you a little introduction about it. So inverted eyelids are actually, in vet terms, referred to as entropion, and this is found in all goat and sheep breeds. The condition is non-lethal. However, inverted eyelids can be passed on genetically, and any animal with this problem should not be retained for breeding purposes. Some genetic family lines of white-faced sheep tend to be more prone to this fault. Some people like to think that it's environmental conditions that cause this, but really it tends to just be genetic, and it's passed on. Clinical signs of it, the inverted eyelids, this is a situation where the eyelids are turned in or inverted, and what ends up happening is irritation and abrasions happen to the cornea of the eye. It causes severe tearing and usually occurs in young animals within the first 1 to 2 weeks of life. Now, generally the most common location of this condition is found on the lower eyelid, although either one or both eyelids can be involved, and either one or both eyes can be involved. If uncorrected, the inverted eyelids will damage to the cornea of the eye and will cause ulceration, cloudiness of the cornea, and in some cases it can even cause blindness. So this is something that you want to be paying attention for. The first clinical sign is going to be that tearing, and you'll usually notice it within the first couple of days of life. So within that first week, when we're doing our tail docking and our tagging, this is when we look for it, and this is when we treat it.
All right, so what we have here is we have a lamb that's got an inverted eyelid. The first signs of the inverted eyelid is going to be the drainage around the eye, but if you look at this baby up close, you can see how the eye is infected and the eyelid is actually rubbing on the eye. So there's a couple different things that you can do. One thing you can do is you can give an injection of penicillin directly underneath the eye, or you can use surgical clips. In this case, we're going to use surgical clips. The first thing that I want to do is I want to remove any of this goop here on her eye. So I want to rub from inner canthus to outer canthus. We want to rub away from the eye, and as gently as you can, you want to get all of that goop away from there. Try to get it as clean as we possibly can. The next thing that I'm going to do is I'm going to take a syringe that has penicillin in it. This is injectable long-acting penicillin, and I'm actually going to apply some of this directly into the eye, just with the blunt tip. Don't hit the eye with the blunt tip, but you're gonna put some of this right inside the eye, just a little bit. And you can see it's actually filled up the eye there. That's just a prophylactic to prevent any kind of an infection that may occur. So the next thing we're going to do is apply the clip. And that clip, this is what the clip looks like. And this is my clip applicator. There's different types of applicators that you can get online through veterinary supply houses. This is the one that we're going to use. So this clip, if I can get it off of here. If you look, it has these sharp barbed edges on here. Those barbed edges are going to go together, and they're going to go up in the eye. It's going to get pinched, and it's going to pinch the eyelid underneath. Now, I know it sounds kind of cruel, but what this is going to do is this is going to pull that eyelid out away from the eye, and it's going to allow it to no longer rub up against the eye. If you look at this lamb's eye up close, you can see how it's cloudy down there, and that's where her inverted eyelid is actually scratching the cornea. So that's something that we definitely want to fix. So we're going to take our clip here, and we're going to attach it into our clip holder. And now as I squeeze, this is naturally going to bend and it's going to clamp. It's going to be a little uncomfortable for the animal, but as I said, in the end, it's going to help. So what we're going to do is we're going to grab underneath the eyelid and we're going to pinch just like that. And that's it. It's over. And what that's going to do is that's going to cause some swelling. And you can see it's pulled that eyelid out away from the eye, and it's going to keep her from getting a further infection, and it's going to keep her from having that eyelid scratch that cornea. So things you can do, really this is an inherited trait in animals. So the best thing that you can do to prevent it from occurring in your flock is to cull the animal, not allow her to breed. But in our case, we have a small enough number of lambs that we can keep on top of them. If you were running a flock where you had 300 or 400 breeding stock, you would definitely want to cull them, because there's no way that you can keep up with what's going on out there. So as you can see, it doesn't bother her a bit. She's not uncomfortable. As a matter of fact, she's probably already feeling better, because that's relieved the scratching from the eye. And as time goes on, this clip will naturally fall out. If it doesn't fall out here in about a month or so, I can go in with my clip cutter here. I can go in there and actually cut it and take it out. But they usually fall out on their own. The eyelid will correct itself, and she should be fine. The only other thing that I want to mention is, because this lamb has not had her tetanus, her CD&T, or her tetanus antitoxin, anytime I'm creating a wound, even if it's this small, I want to make sure that I appropriately treat this animal to prevent her from getting tetanus. Now, in this case, she has not had tetanus antitoxin because I have not docked or banded her yet, or tagged her ear. So at this point, I'm going to go ahead and give her tetanus antitoxin shot as well.
So in the method we just performed, you saw how I placed the clip horizontally underneath the eye. I just want to show you a picture of this. This is for a really, really bad case of inturned eyelid or inverted eyelid, where the eyelid, having that single horizontal clip underneath did not work. And you can see in this case, the individual placed 3 vertical clips in there to help hold that eyelid down. I have never had to do this. I've never had an inverted eyelid that bad. However, if the horizontal clip doesn't work, this is another option for you. However, if it were me, if it was this bad that I need to put this many clips down there, I would probably go to the veterinarian and talk with them, because surgical intervention might be better at this point, instead of putting all of those clips in. Well, that is it for the video. Thanks for watching. We hope you enjoyed the video as much as we enjoyed making it for you. Remember, if you have questions, send them to us and we'll make a video just for you. Again, don't forget to subscribe, don't forget those thumbs up, and check us out on Facebook at Lanessa Farms LLC, Twitter at Lanessa LLC, YouTube Lanessa Farms LLC, and of course Instagram at Lanessa_farms. We will see you next time.